Hello and welcome to another episode of Yell Fire, Conversations to Combat the Lie of White Supremacy. I'm your host, random white dude, Craig Pelkulandis. My guest today is Nicole D Vick, who has spent her career as an advocate and educator in the field of public health. Specifically, we're going to, as you can imagine, talk about race and public health. The American Public Health Association began tracking declarations of racism as a public health crisis in the summer of 2020. Been going on long before that, but at least they started tracking it in 2020. Since then, over 260 cities, counties, public health agencies, and academic institutions have declared racism a public health crisis and have committed resources to dismantling the systems that reinforce health inequity. The goal is more equitable policies, practices, and allocation of resources. And of course, since 2025, since the beginning of this year, the current administration in DC is doing everything in its power to roll back these initiatives and criminalize anti-racism, basically. So here we are. Before we get started with my conversation with Nicole, here are just a few public health data points from a 2024 Kaiser Family Foundation research presentation. So one data point, life expectancy, Native Americans at 67.9 years and Black Americans at 72.8 years have a shorter life expectancy compared with white Americans at 77.5 years. Childbirth mortality, Black and Native infants were at least two times more likely to die as white infants as of 2022. Black and Indigenous women also had the highest rates of pregnancy-related mortality. So again, this is the world we're living in. My guest, Nicole D Vick, has been living and working in South Central Los Angeles for years and years and years. She brings a wealth of lived experiences along with her research and decades of work in public health. So thanks for tuning in. Please like and subscribe, give us a good rating, and enjoy the conversation. Well, Nicole D Vick, thanks so much for joining us here on Yell Fire. Excited for this conversation.
Likewise, super excited.
Oh, thank you. Thanks. Yeah, I really appreciate you taking the time. So Nicole D Vick, you are in the public health space in education and advocacy. Just tell us a little bit about your background and what you're up to these days in the public health arena.
Sure. So I have about 20 years of experience in public health, and I work, specifically in local health departments. And I won't name the health department because I don't think it's
Yeah,
really important.
sure.
But I've been there for 20 years. My focus was the workforce. I found an interest in the public health workforce during my time in that local health department. And then I also have 15 years, almost 15 years of teaching experience. I taught undergrad students public health at Cal State LA, Occidental College, where our former president went to school for a little while. And they do not let you forget that. You see his face everywhere on that campus, which
Awesome.
I love that. I've taught online, so I have sort of this really cool, work experience, and then just a little bit of a touch into academia. And then, of course, I got my doctorate in education in organizational change and leadership, which is, you know, people would say, well, why didn't you get your doctorate in public health? I'm like, I think the 20 years in public health was the doctorate.
Yeah, yeah.
Yeah, and I kind of wanted to look at it from an organizational leadership sort of perspective as opposed to a public health perspective. So,
Okay,
yeah.
gotcha. Interesting. All right, cool. Cool. Well, and so you are based in Greater Los Angeles, and so um, let's talk a little bit about what public health and kind of the racial dynamics of public health in Los Angeles, and maybe we can zoom out from there, but let's zoom in for the moment on Los Angeles.
And I feel like, I don't know if we need to give a little context about what public health is. I don't know if folks
Yeah. Oh, yeah. Please do.
coming
Yeah.
into this
Yeah.
space.
Because I'm like, pretend I'm ignorant because I definitely am.
So some people think public health and healthcare are synonymous or the same thing, and they're actually not. Now they do work together, but they're a little bit different. So public health is about prevention of disease and promotion of health in communities. Our patient is community, and community could be a city, it could be a state, it could be a specific demographic, Black people, it could be children, right? So that's kind of our focus. And we're looking at how to keep people from getting sick in the first place, because we all know that once you're sick, it sometimes is expensive to take care of you. So if we can keep you from getting sick, we can do that in a cost-effective way. And then you
Yeah.
go about your merry life and you're great. You have your flu shot, the restaurant has been inspected and it doesn't have rats, and you eat healthy food and all these great things. So it that's the most basic definition of what public health is. And
Hmm.
so your question about racism in public health, I did my dissertation on the psychological safety of Black local health department employees. And
Oh,
when I started digging, because you got to build up your what is called chapter 2, your lit review, you got to start kind of building these arguments and making these cases to get to where you're going. And I said, public health is racist.
yes.
So I had to
Okay.
figure out how to prove that. Like,
Oh, wow.
okay, so all right, Nicole, that's what you think. So then go do the research, go dig in the crates, right, so to
Mhm.
speak, and
Right. Right.
find
Right.
that evidence in that literature that backs it up. And I actually did.
Hmm.
Um, but to answer your question more directly, I think that how we see racism show up in public health in Los Angeles, in New York, in Houston, in any of these cities, same, we see it everywhere. Anti-immigrant policies are
Hmm.
anti-public health,
Yeah.
they are racist.
Yeah.
When we see cities that have a lot of homelessness, and you think about the demographics of those people that are homeless, pay attention to those demographics and you'll start to see where those things bubble up.
Yeah.
Access issues. How come people can't afford their housing? How come people can't get access to good food? How
Hmm.
come certain communities are overburdened with environmental toxins? Why is that neighborhood next to
Yeah.
the toxic waste dump? Right? That's where you start to see uh, anti-blackness or
Yeah. Yeah.
racism in public health in our systems.
Okay. Cool. How, so you did this research for your dissertation. W- what are some specifics that you found, and kind of how you maybe addressed that over the course of your years in the sector?
Sure. So one of the things that was interesting to me, there was an article written by someone named Oppenheimer, and he literally laid it out. He said, listen, in the beginnings of our public health system, Black people, and so he did the very much Black-white dynamic,
Mm,
because he was talking about in the beginnings of this country, post-slavery, there was really no consideration for Black folk in these decisions about how we're creating a
yep.
public health system. And
Yeah.
what happened was, the sentiment was, y'all figure it out for yourselves.
Mm,
You, with no infrastructure, with no money, you figure out how to take care of your community on your own.
right.
And they talked about things like syphilis and how the data is recorded. And there was a journal article in the American Journal of Public Health, or was it APHA? One of the two journals that said syphilis is a Negro problem. And this was probably
Whoa.
1945. And so it was interesting to
Mm,
read that as it was in that journal. I read it, the original journal article, and then to see the response from a Black physician that said, that's not right. Right?
yeah.
We have to talk about the social determinants of health. Why are certain demographics getting sick more than others? When you
Hmm.
take away their housing, you take away their access
Yeah.
to health care, what do you expect to happen? So even then, the conversations around, wait a minute, these inequities are not natural and
Right.
we need to fix them. So it was just a really interesting sort of road trip that I went down in, those journals, figuring out and understanding those, sort of how people thought. The African American infant and maternal mortality rates are still really bad today, but they were still really bad back then.
Hmm.
And so some of those things that we see that still persist are indications that we have a problem with our public health system. And I'll say this, because I don't want to make it sound like we're just all over here, just horrible people. There has been a lot of work over the last few decades around this concept of health equity, eliminating
Yeah,
health
yeah, yeah.
disparities, really taking into account those things. And I think they're important steps. But to me, the fact, and I know we're going to talk about this, to me, the fact that this administration can so very quickly and swiftly take all of those sort of
Yeah,
advances
yeah, yeah.
away, to me,
Yep.
speaks again to the core fact that our system is founded on the structure and system of white supremacy. Because
Yeah,
why
yeah,
is it so easy to just say,
yeah.
did it all go away?
Yep. Yeah, exactly. Um, yeah, that's one of my thoughts as you were laying this out was that yeah, because whiteness was the default normal, um, nobody else effing mattered. And
Nope.
that's the cold reality of the systems that we're working in. So yeah, I did want to like drill down into um in one of my kind of early anti-racism trainings, we did an exercise called Better Worse. And so, like, how is equity better? How are Black people's lives better? How are, people who are minoritized in this society, how are they better? How are they worse now than when you were a kid or whatever? So we kind of analyze that. So maybe through the lens of different like political parties and administrations, how has public health uh, and the systemic racism in public health, how has that changed? How have things gotten better? How have they gotten obviously in this timeline of Felon
Yeah,
47, things are incredibly worse and it's insane. But
it's really bad.
yeah. But like if you could prior to January of this year, what were things? Because this is we're throwing off the yeah, but like you said, just a few sweeps of the pen, like strokes of the pen, and a few uh, choices of people leading different play different parts of the system, and you
Yep,
get
it's
and
gone.
it all gets
Disappears.
blown away. So anyway, yeah, I'm
You,
sorry. You
you know what I kind of compare it to, and I don't know. Sometimes I'll be asleep or I'll just be daydreaming and oh, that's it. So now, sometimes with your computer or your phone, you have to do a hard reset, right? Something happens to it,
Yeah,
and
yeah,
you
yeah.
call tech support, and they're like, we got to do a hard reset. We got to start this all the way over.
Hmm.
I liken what is happening now to a hard reset. We're literally going back to what it was before. And to me,
Hmm.
that tells me that what it is what it is. So
Hmm.
if I say that public health was built on a culture of white supremacy, and you say, no, 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 we've done so much. But if we're able to go right back to what it was, then what is it?
Yeah. Yeah,
Right?
exactly. Yep. Yeah, yeah.
To your
Yeah.
point, there have been times in our history where I think that we have said, oh, we have to do things differently, right? I was on a radio show not so long ago, and one of the hosts brought up, well, when we started getting things like Social Security and some of those types of policy
Hmm.
sort of decisions, those were the times where things were heading in the right direction. Wait a minute, we have to take care of our population. We have to take care of everyone
Hmm.
and make sure that they all get the access to live their best lives. But
Hmm.
again, you could say, well, there are some administrations that were better than others. But again, if to me, if you can take something and go and just turn the light switch off and it automatically defaults back, did
Yeah.
we really do anything? Did we really fix anything? So how do
Yeah.
we now, in this space where everything is getting taken,
Yeah.
research funding, HIV funding, vaccinations are
Hmm.
going away, is this the time where we get to rebuild? Because some of
Yeah.
us are like, wow, we're in shambles. I know people said burn the system down, but is this burning up the system? Because if
Yeah.
it is, I don't
Yeah.
know if that's what we meant. But this could be the time for us as a society, not just the public health professionals, as a society collectively to say, what do we want this to look like moving
Mm-hmm.
forward? And can we get
Yeah,
to that? So, but that requires a lot of investment from folks. We got to
yeah,
be
yeah, yeah,
bipartisan.
yeah,
People got to come to, so I don't
mm-hmm.
know. I don't know, Craig.
Yeah.
I don't know.
I don't know. Yeah, no, I'm with you. I mean, in the political realm, I hear, when people are taking a hopeful note, they say, "Oh, well, maybe this could usher in a new progressive era." And I always say, "Well, I hope that progressive era is an anti-racist progressive era because the previous one was not." So we got to fix that. But yeah, yeah, that there's when you're talking about this stuff and thinking about this stuff, one of the little glimmers of hope I have is that that white people are noticing the racism. We're in an era where like, oh my gosh, this things are pretty dang racist here. Oh my gosh, what is happening?
And then, and meanwhile, we're like, yes, we were trying to tell you that for
Yeah,
the last like
exactly. Yeah,
400 years. We
yeah,
saw it, we knew it in our
right,
spirit.
right.
But hey, whenever you get it, let's go.
Welcome to
Let's
the
walk
party.
together. Come on, grab a cup of tea and let's go. We got work to do. Okay,
Yeah,
so
for sure, for sure. Um, well, let's see. So, yeah, we've covered kind of Bobby Kennedy Jr.'s kind of blowing up the all of the guardrails. And
yes,
I hadn't thought about it quite the way you put it. That yeah, it's a reset back to the baseline of structural racism, and that's
absolutely.
messed up.
And I think that something I want to also lift up too, because you actually brought something up and it a little light bulb went off. This stuff doesn't just harm Black people, Latino people,
Hmm.
Asian people, trans people.
Hmm.
This harms everyone,
Yeah, yeah.
right? Because you're seeing it now. Oh my goodness, they're going to take the food stamps away. Guess who's the largest recipient of food stamps? It's not, I'm not on food stamps, right?
Right.
So
Yeah,
it
yeah, yeah.
harms everyone.
Yeah.
And I think that's where we need to get back to. And I will admit that for some reason, public health people, we have not done a good job of articulating the value of public health
Hmm.
beyond sort of helping disenfranchise or minoritized people. I don't
Hmm.
know if we've done a good job of doing what is it
Uh,
called, a public publicity campaign
yeah.
around sort of how we help everybody. No,
Yeah.
yeah, you
Yeah.
have health insurance, Craig, but guess what? If they take away Medicare and Medicaid,
Right.
it won't matter because Craig, if you need to go to the hospital, you will be sitting there all day because everybody else that doesn't have health insurance is also going to be in the hospital with you. So you're
Yeah.
also going to suffer. I think that's the other side of it. We have not done a very good job of helping everybody understand sort of the broader impact
Hmm.
of what we think is that's for the poor people over there.
Right.
We
Right. Right.
haven't made that clear.
Yeah. But when you get rid of like research and creating, the vaccines that were in the works and the I forget what that specific science is called, but yeah, the HHS is doing away with vaccine research, which is insane. Why are you trying to kill all of us?
And that's the reality. So I tell people, everybody says, "Oh my gosh, what if we have another COVID?" It is not an if.
Yeah, yeah.
It is a when. And it might not be COVID, it'll be something else. I was taught that in graduate school because I had went to go get my MPH degree. They
Hmm.
teach us that it's not a if, it's a when.
Hmm.
We already know that viruses do the thing that they do, and then and then
Yeah.
once they get big enough and spread, we haven't been exposed to these things. So then when we get exposed, we die. So
Yeah,
if we
yeah.
don't have vaccination research and we don't have the scientists, even more importantly, we don't have the scientists because you laid them all off
Right,
that
right,
know
right.
how to do this work because they're experts. What are we left with? I think COVID-19 should have taught us a lot There were lots of lessons to be learned there, but it almost feels like, and I don't know, you tell me, Craig, it almost feels like it never happened. Like everybody forgot that
Yeah,
all
yeah.
these million people died.
Right.
Our bus drivers died, our grocery store clerks died, our nurses died. Like
Hmm.
they just forgot, and we're like,
Hmm.
oh, we're back to. But what were the lessons learned from that so that when it happens
Right.
again, because I said it's going
Yeah.
to happen, when it
Yep.
does, we'll be prepared. I think
Yeah.
we are. This is a really scary time, especially for folks that understand this work
Hmm.
very deeply, because it's like all we need is one pandemic, a baby, not
Yep.
even a big one, a baby pandemic, and it's like, what happened?
Yep. Yep. Yep.
And it
Somebody
won't
on a,
matter that you
yeah.
have insurance, Craig. It won't. It
Yeah.
won't.
No, right. Yeah. Well, yeah. And then there's the whole, I mean, insurance is another topic altogether.
Yes.
And well, and actually, this isn't, I didn't give you this as a question beforehand, but how does the lack of, well, we've touched on it. How does the lack of affordable, like public healthcare, like single payer or whatever, we're the only, you know, industrialized country that lacks this, and for whatever reason, I mean, that's another, I think it's another vestige of the lie of white supremacy. We can handle it, and or we're not,
Right.
we're gonna
Yeah.
do it on our own.
Yeah.
Nobody can tell me how to stay healthy.
Yeah.
Or that stuff is killing. So, what is that difference between us and Canada? Like, let's just or anywhere else that has a public health system. Um,
Sure.
what does
I
that
just
do
feel like
to us?
one of the biggest things that it sounds like to me, and I don't know enough about the healthcare system in Canada, but I've heard some things. I think for me, what it sounds like is the biggest issue with is we have an issue with access that maybe Canada doesn't have, right?
Yeah.
Where if you don't feel well, you're not worried about, oh shoot, should I go to the doctor or not? I
Yeah.
hear people all the time, well, I can't afford it. Or if you're in an emergency, well, the ambulance ride is $1,000. I don't have that,
Yeah.
so I'm just not going to go. It doesn't sound like Canada has those kinds of issues. There may
Right.
be other issues as far as like, well, it takes a while to be seen, but if you don't have to worry about how much it's going to cost you, or, well, I can't afford the ambulance ride, I think that takes a lot of a
Mhm.
burden off of a lot of people to make decisions about whether they go to see their doctor or not. I've also noticed that recently a lot of physicians, especially primary care physicians, are going into this sort of, I don't know what you call it, but they're going into a system where you would pay them $100 a month outside of your insurance. So
Mhm.
this is not even insurance. You pay them and you have direct access to them, which is really different. And it's like, I think it's sort of a way to try to circumvent sort of some of the issues that come up with health insurance companies
Mhm.
where maybe their reimbursement rates are too low and the physician is like, I can't even take care of my own family because I can't
Yeah.
afford to live. So here's a way for me to have more direct access. So
Mm.
I'm starting to see, folks getting a little creative about healthcare in this country,
Okay.
but
Huh.
we really just need a better system overall.
Yeah.
Quick story, side story. I'm glad you brought healthcare up. Do you know I broke my ankle in June of last year and it took 3 months to get my ankle fixed?
Oh,
And I
wow.
have health insurance.
Yeah. 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 Wow. Huh. So it took to be seen and get it said and all, and for all the right people to be involved. It took 3 months. Wow.
I got passed around from doctor to doctor.
Wow. Wow.
Um, and I had to finally call the insurance company back because the doctors were telling me to go to the emergency room. I know
Hmm.
better than that. That is
Yeah.
not the solution. That is
Yeah.
not the healthcare answer to a broken ankle.
Hmm.
But I called their bluff. I went to the emergency room and they looked at me like, why are you here? It's like, I don't know. They told me to come.
Wow.
So I had to literally call the insurance company back and say, what do you want me to do? My ankle has
Oh,
been broken now for 3 months.
wow.
I have
Wow.
no course of action. I went to the hospital and they sent me right back home in an ambulance.
Yeah.
What do you want me to do?
Wow.
And I had to switch medical groups but I had to switch to the group in the Beverly Hills neighborhood.
Oh.
I live in South Los Angeles. That is when my ankle got fixed.
Oh, wow. Oh my. Yeah. Oh, interesting. Okay.
Yes,
Wow.
very.
Wow. Wow.
See?
Wow.
See?
Uh-huh. Oh man. So, and you're the expert at navigating the this kind of stuff. So, if you're having problems, we're all in trouble, man.
And that was the thing I would tell everybody that I talked to, my brother, anybody. I said, if I'm having a hard time, what if I didn't speak English? What if I was here by
Hmm.
myself?
Yeah, yeah.
What if I was neurodivergent? What if I, had Medi-Cal? What
Hmm.
all these things? I'm like, this is bad enough for me, and I get it, right? Because I work in a
Hmm.
healthcare adjacent field and
Yeah,
still got treated that way.
yeah,
But
yeah,
because and people were telling me, Nicole, people would have given up. People would have just given up.
yeah,
They would have
sure.
kept the little boot on them, and their ankle would have just been broken forever. And I said,
Wow.
that's unacceptable. It's
Wow.
unacceptable.
Yeah, yeah. Um, well, on that note, let's try to switch to some hope. So,
It's horrible.
so you've spent some time in the classroom. How does teaching about these kinds of things, how does that give you hope for the future, or hopefully it does? Yeah.
Yeah, it does. I love it. I had to stop because I was in school and I'm like, okay, Nicole,
Yeah, yeah. Too many
you can't
things.
listen, So, but when I was doing it, I loved it. And I loved each environment that I taught in. So I taught at Cal State LA, very much a commuter school. These
Hmm.
are, folks that are probably working and, maybe lower income, not necessarily, but they have a different perspective than the kids at Occidental College. But I had a great time with both sets of students. And what I told them was, I want you to have the Black Girl Magic version of public health. I want you to understand public health from a social justice lens. I want you to have these
Hmm.
glasses of social justice on your
Yeah, yeah,
eyeballs,
yeah,
and I
yeah.
want you to never take them off because that will reflect and impact how you see everything, how you move in the world, how you vote, and everything. So that was
Hmm.
like
Hmm.
the best experience. And there have been a couple of students over the years that have gone either into either healthcare or public health that I've kept in touch with. And I'm just always so excited for them. And I feel like their little auntie over there on the side. Yeah.
Nice.
Um, and I think that it is our responsibility as public health professionals, especially if you are minoritized, they need to see
Mm.
us in
Yeah.
these spaces doing this work because it's like, oh shoot, I can do that too. So I've had interns that I've talked to and helped to navigate them through. But teaching is something that I really love, and I'm trying to actually get back into it because I'm like I need to talk to these folks because, and I
Yeah.
always tell them I'm going to retire sooner than later, and I need you to be in here and figure this stuff out because we got to get this right. We got to figure it
Hmm.
out, and we need y'all, this new energy, this new frame of mind to come in and help us figure this stuff out. So
Yeah.
it's always for me a really exciting time for me to share with them my lived experience, which is relevant. I was a teen mom. I talked to them about that from a public health perspective. As a Black
Mm-hmm.
woman,
Yeah,
I
yeah.
talked to them about that. I have all this experience at work. Like I bring that work when COVID was going on. Oh, it was like scary yet exciting. I'm like, oh my gosh, you guys, guess what happened today?
Oh, wow.
And this is what this means. And
Hmm.
I was really able to share with them what was going on and give them some context because they were living through it too and they were scared, especially that first class. Literally saw them before
Yeah.
spring break in person. And then after that, it was like everything was in shambles. Y'all got to go home. And we
Hmm.
were trying to do class online. And I was really trying to literally at that point walk them through like, it's going to be okay. We're
Wow.
not going to have a final. But what I want you to do is talk to me about what you're going through and layer that over what I taught you in class. That was their final and most compelling essays I've ever read in my
Wow,
entire
I can imagine. That's amazing.
but I told them you're living through public health history. Don't forget it.
Hmm.
Don't forget this moment because this is what we're talking about when we talk about equity and social justice and how we make sure we take care of our people. And so I hope they haven't forgotten it. But that's kind
Yeah.
of what I bring into the classroom. And I'm like, yeah, yeah, yeah. And they're like,
Yeah. No, that sounds
okay,
amazing.
professor.
Oh, they just want to go get a taco after class or something.
Right? Oh my
No,
gosh.
but it sounds like that was a big impact.
Yes,
Yeah. Wow.
yes, it
Wow. Wow.
was. And honestly, yes, for them because they're the students, but I mean, come on, I was getting something out of it too
Sure.
because I got to hear their perspective. Like, how do you see this? Does this
Mhm.
make sense to you? What would
Mhm.
you do? And they actually had some really good insight on a lot of things. And so it was
Mhm.
also good to hear from them. Because for a long time, my daughter was the same age as the students, but
Okay.
she old now. She's like almost 30. So they're the only ones that keep me kind of tuned into what's really going on from
Yeah,
their perspective in the world. So
sure.
I think I got as much out of it as they did.
Awesome. Wonderful. Well, cool. Um, have I left anything out? Oh, I did want to talk a little bit about cultural competence in public health, how to connect people across differences, across ethnic, whatever, language differences. How were you involved at all in helping coworkers or people kind of increase their cultural competence? Maybe that's has something to do with your degree now, but
Yeah, I
anyway.
mean, I feel like there's always, for me, an opportunity to do that. In my career, there have been times over the years where they're like, "Yeah, we want to go to the Black community and talk about a thing. Can we do it like this?" And I'm like, "No, don't do that. That's not how, that doesn't work like that.
Yeah, yeah.
Like you're literally talking to someone that lives in that community. That doesn't resonate." So, that is one thing. There's always this thing about language justice that is
Mm,
is really taking hold now, I think more than ever. Like health literacy is a thing, right? Making sure people understand health information the first time they read it, which is fine. But then language justice adds in that layer of, okay, well, is it in Spanish? Is it in an
mm,
indigenous language?
mm.
Is it in Braille? If you are
Yeah,
sight
yeah.
impaired or blind, can you see it? If you're
Hmm.
deaf, how do you access it? So, like, really sort of going beyond just that simple translation of print materials into thinking
Hmm.
about other ways that people can understand language. And part of that is understanding the culture of that community.
Hmm.
Certain things that you would write in English, you don't write it that way in Thai or
Right.
Tagalog because,
Yeah.
certain colors you don't use because it means something different. If you're writing something or preparing something for the deaf community, you might have to think differently about that, how that
Hmm.
information is presented.
Hmm.
So a lot of that has to do not just with understanding the language, but also understanding the culture. And,
Yeah.
and the best way to do that is to talk to the people in the culture.
Sure.
Sounds
Sure, sure.
simple, but let me tell you, a lot of times folks forget that. And I don't know. Let me go look in this book. Talk to the people.
Wow.
Why are you acting like you're scared? Go over there and ask what they need because let me tell you something. They will tell you exactly what they need.
Wow. Wow. Simple as that. Cool.
Yes.
Ah, love it. Love it. Okay. Well, so I don't want to take too much of your time. Did I not cover something that you wanted to cover, or are there questions that you wish people would ask on these in these conversations that I haven't asked?
This has been great. I love talking, as you can tell, I love
Yeah.
talking about my work. I
Mhm.
think one of the things that I wish people knew is that public health has more reach into your lives than you realize. And honestly, what we always say in our field is when we're doing our job, you don't see us.
Mhm.
So you be grateful, yay! But when you see us, that means something happened. Everybody
Yeah.
run. But we definitely have much more involvement in your life than you realize, public
Mhm.
health as an institution. And I think that we need to, I really want people to vote and think about not just yourself. I know it's hard, because we have so much to worry about in our own lives, but think about other people. Think about other people's lived experiences, their lives, and how they may be different from yours. Vote in that way. What is the person who uses a wheelchair? How would this policy impact them? Would it make
Mhm.
their lives easier? Then I'm gonna vote. I'm
Mhm.
gonna vote in that way because we have to take care of those that are marginalized and minoritized. If we vote in that
Mhm.
way and center them instead of
Yep.
pushing them out, center them, all of us benefit. Think about the curb cuts in the sidewalk at the
Yeah,
end of the.
yeah, exactly.
They
Yep.
benefit a lot of people, not
Mhm.
just people that use wheelchairs. The kids
Yep.
with the scooters, the mom with the stroller, the parent with the stroller. Like, think about that kind of thing. How I need to be voting in the way that makes sure that everybody, not just people
Hmm.
that look like me, and I'm talking about even just me as a Black person.
Hmm.
Let me think about my trans brothers and sisters. I need to
Yeah,
vote to make
yeah.
sure they have rights.
Right, right.
So if we gotta vote differently and not be so selfish, and I know for some reason for us as society is really hard. Like, no, think outside of
Yeah,
yourself,
yeah.
please,
Well,
please.
yeah. Well, I do really appreciate that. I will say that as I look at the data, if we would all vote the way Black women vote, we would be a lot better shape.
Well, I'm glad you said it. Somebody said it. We tried. We really
Listen
did.
to
We
Black
did.
women. Okay, that's my. Well, wow, Nicole, this was really a great conversation. I appreciate your time. Thanks for joining me here on Yell Fire. Well, hey, thanks again for joining us here on Yell Fire. Thanks again to my guest, Nicole D Vick. If you want to learn more about her, there'll be contact info and ways to reach out and learn more about her in the show notes. Um, Again, please like and subscribe wherever you're listening or watching this. Subscribe to the newsletter, the Yellfire newsletter at yellfire.substack.com. You can join me and folks like Heather Cox Richardson and Joy Reid on Substack as we try to counter the racist overtones that Substack likes to amplify. So we're countering that kind of nonsense. Yes, Heather Cox Richardson, Joy Reid, people like that. We're exactly the same. Those folks. No, I'm kidding. A learned scholar and an amazing public figure, journalist, and I'm just a random white dude. So anyway, but Substack, join us there. Thanks for watching, listening, and see you next time. Thanks.